If you are preparing for OSCE, you would have heard about PQRST pain assessment. Now, this is where a lot of the candidates go wrong in applying this in OSCE. I'm going to show you how to apply this PQRST in your OSCE scenarios. Just remember, PQRST is just not a checklist. It's actually a structured conversation between you and your patient. So let's dig into it. When you go and see a patient in an OSCE or in your real life scenario, you introduce yourself and you greet and you do a physical assessment quickly with your eyes, see how the patient appears, if they're anxious or things like that. Now, then you got to let the patient know, I'm here to do a pain assessment. I might be asking you a few questions. Is that okay with you? So before you start, always ask permission from the patient. Get a consent. In this case, a verbal consent should be enough. Once the patient agrees, you start to ask them questions. Not as a checklist way. You don't want to sound too robotic. What you want to do, have a normal conversation with the patient. I'm going to explain more about it now. Now, what does P stands for? You might already aware. P for provocation or palliation. We don't really ask the patient what provokes your pain, because the patient might get a bit confused. What are they asking me? Instead, you want to simplify it and ask them questions like, do you mind if I ask you what makes your pain worse? Or what makes it better? Can you tell me more about it? Then the patient start to explain what makes it worse or better, what provokes the pain or what caused it. So things like that. So you want to encourage them to talk. Then you're getting your data from it. Then if you're moving to Q, which is quality of the pain, of course you're not going to ask, can you tell me the quality of your pain? Imagine you asking the patient that question. And the patient might be thinking, oh, quality of the pain, what does that mean? Instead, you want to ask the patient, can you explain your pain to me? What does it feel like? Or then the patient might think, oh yeah, it feels sharp, or it's like a stabbing pain. Or you can give some hints. If they are still confused, you might say, oh yeah, how does the pain feel to you? Is it like a dull ache or a sharp pain? Then the patient clicks instantly. They might say, no, it is a dull ache. It's very dull, it's not that sharp. So they can explain all these things to you. Then you get the quality of the pain like that, It could be a sharp pain, it could be a dull ache, it could be a stabbing like pain. So there's a lot of variations for pain. So you could ask in a way that the patient understands what the question is, and you get your information, and it has to feel quite natural. Now the next one is R for radiation or region. Now you have to ask the patient, where is the pain? So the patient might say, yeah, it's in my chest. So you really want to know where exactly is the pain is. So you want to use some other methods to ask the patient, now, can you show me where the pain is? Can you point where the pain is? So the patient might just touch, this is exactly here, the pain. Okay, that's right in the middle of your chest. Then you would ask the question, so is the pain just staying in one place, or is it moving anywhere else? You can ask, is it radiating? Or you can ask, is that pain staying in one place, or moving to other places? That means giving them hints so they can answer you. And they might say, oh yeah, that's right. Yeah, the pain's actually spreading to my back or my arm. So they would explain more. So this has to be a natural conversation between you and your patient. So you get the information by talking to them and help them with those things. Now the next one is S, which is severity of your pain. So you can ask the patient, use simple words like, you might not want to go, how severe is the pain? And then the patient might think, oh, how severe is it? They have no scale to think of, because one person severe means different to another person severe. So you might want to ask them, okay, now can you tell me how bad is your pain is? And you could always give a pain scale, which is very helpful. When I train my clients, I always ask them to use this pain scale. So can you rate your pain out of 10? 10 being the worst pain you could ever have, and 0 being no pain. So when you say 1 to 10, you have to explain what 1 means and what 10 means, because, or what 0 means or what 10 means, because they need to gauge it as well, so to give you the right answer. So you might say 0 being no pain at all. So use your body language, use your face expressions, use your words, everything. It's a communication, and tell them 10 being the worst pain you could ever have. So now they have an idea, okay, where I'm sitting in this. They might tell you it's 5, it's 8. They might say, yeah, it's 10. You would see people say, yeah, it's 10 out of 10, right? Now you got that idea as well. Now, think about the situations where you cannot use, or if you use, it might not be as helpful if you use the pain scale, 0 to 10. Think about those scenarios. Now, if someone has dementia, they might not be able to process those kind of things in their brain as you ask. So you got to be careful when you ask this as well. So what do you ask the children? You don't want to ask the children, can you rate your pain out of 0 to 10? Because they might not be able to comprehend it very well. So you might want to use some other methods like facial expressions, how they act, things like that. So be mindful of that as well. So moving from the severity to the timing. Now, timing means, when did the pain start? So you can ask simple questions like, when did the pain start? Or was it intermittent? Is it coming and going? Was it there all the time? Because all these things matter. And there's one thing people don't really give importance to, because timing is very important, which people miss all the time. Because the nature of the pain, when did it start? Is it coming and going? Is it constant? These kind of information is going to give you a lot of insight into the actual diagnosis. So that is very important. Now we understand PQRST. It's very good to understand it. Now, understanding doesn't mean that you're going to be doing it the best. Why is that? Because it does need practice. You have to practice this every day in a structured way and like a normal conversation before you go to OSCE. I do give a 30 minutes free consultation over the phone or online. If you still want to know more, or if you want to know where you're standing right now in terms of your assessment skills, in terms of your communication skills, in terms of your OSCE skills. If you're worried, send me a message. We can book a time with you. And it's 100% free. Use that opportunity. I'll see you there as well.